I'm Dr. Sushil Kotru. I'm working as consultant and head department of endocrinology, a max specialty hospital, Bathinda. I have with me Dietitian Leena Sharma. She is our head department of nutrition, working with me in my department. Today we are going to talk about comprehensive diabetes care. As all of us know, controlling blood sugar is only a part of story of diabetes management. We have to provide 360-degree diabetes care to the patients. Ours is a department which provides comprehensive diabetes care. For that, we have a proper team of diabetes educators, counselors, and dietitians. You are doing that care. And I have a podiatrist with me and other technicians also. And I know, and all of us know that diabetes education is the cornerstone of diabetes management. There are lots of myths about diabetes, and we'll try to correct these myths also. We always organize a session for diabetes patients, and the diabetes management starts with diabetes education. She imparts diabetes education for the patients, and after going through registration, all the new diabetes patients have to go through that diabetes education. And about the diet part also, all the patients and attendants have to attend that education session, and gross diet plan has to be explained in detail to the attendants and the patients. We want to throw some light about the diet part, what type of diet the general diabetes patients have to take. We explain them. There is no diabetes diet. This is basically a healthy diet plan. Yeah. Not only the patient should follow this diet plan, all the members of the family should follow this diet plan. Then only the diabetic patients will also follow the same plan. You want to say something about that?
So diabetic patient need to control his or her blood sugar levels. So as Dr. Kotru said, it is the diet for even for a normal person. So what we do, we divide diet into 3 categories. वैसे तो diet is always individualized, but if अगर उसका कुछ basics अभी अगर लिया जाए तो we divide it into 3 categories. That is red category, yellow category, and green category. Now, first of all, if we talk about red category, in this category, there are foods which we need to avoid. Like foods with high glycemic index, food with high glycemic index, like simple sugars, whether it is jaggery, sugar, honey, or any squashes, bakery products, cake, pastries, chocolate, jam, jellies, and high glycemic index foods like mangoes, banana, chiku, lychees, we have to avoid. And refined food items made from maida or refined flour, like patties or bakery products, all bakery products we need to avoid.
Ice creams, cold drinks, pastries, cakes, jams.
That also.
And we should also avoid red meat because it is rich in
fats.
Highly saturated fats also. And just want to compare with all the traffic signals.
Yes. Red means stop. We need to stop here before taking these foods.
And the yellow category?
The next category is yellow category. In this category, there are some foods which we can take, but in moderation. Like if you are consuming chapati or rice, that need to be in moderation. This shouldn't be like this, if you are feeling hungry, then you will take 4 to 5 chapati at once. Or
just to interrupt you, about the chapati and rice, which is better for diabetes patients?
Rice is having high glycemic index if we compare it with the wheat. But wheat do contain other minerals and vitamins and also fiber. But there's nothing like a diabetic person cannot eat rice. He can eat rice, but he have to add extra salad or extra fiber with it.
Vegetables to that, so that it can
lower
down the glycemic index.
It can be in the form of vegetable rice. It shouldn't be like biryani or fried rice. It should be steamed or boiled rice with extra salad or any source of fiber he can consume with it.
About the non-vegetarian food?
Non-vegetarian foods, one can take eggs. Egg whites are recommended. Yellow ones are not recommended because as it is high in cholesterol. And about flesh foods, it should be in roasted form or in grilled form, not in fried form. There's like some patient asks us, can we eat fish? We say yes, you can take. But what they do, they eat fish pakora.
So it is better to eat grilled fish or
it can be taken in grilled form or in curry form. But not
some fruits can be taken. Diabetes patients can take fruits. up to 150 to 200 grams, and which better or which fruits they should take?
Like apple, papaya, guava, pear, strawberries,
So
melon,
these
they
fruits
can
can be
consume.
taken
Yes,
by
they can
diabetes
consume.
patients. It's not like
Yes.
that.
But it shouldn't be like this, ki they are eating half kg of fruit at once. It
200
should be
grams.
like 100
So
to 150
these are
grams.
the yellow categories, the yellow
Please.
signal, yellow traffic
Yeah,
signal in
pulses,
moderation.
non-veg foods, milk products like curd, lassi, and milk. It should be taken in moderation only.
And milk, which milk is that should be
Skimmed milk.
skimmed, double tone milk is
Yes.
better.
Double tone milk,
And
yes.
the quantity has to be in moderation. And the green signal, which can be taken in
Yes, one can go for green.
extra quantity.
Yeah, there are some patients, they say ki like we are habitual of taking 4 to 5 chapatis at like in one meal, and you are saying ki you have to control your weight and you have to keep your sugar levels in control, so you can take 2 to 3 chapatis only, but I cannot feel satisfied with this amount. What else I can take? Like I feel hungry all the time. So there are some food options which they can opt for whenever they are feeling hungry. Like they can take extra salad, they can take cooked vegetable or sorted vegetables,
They should
thin
start their
buttermilk.
meal with salad,
Yeah,
with boiled
yeah,
vegetables.
that is better. They can also go for clear soups without that should be like without oil or fat, है ना?
And
They
you
should
see the
avoid all
Indian
kind of
culture,
fat.
we are fond of tea, lot of coffee also. People prefer to use
Yeah.
coffee these days. It's better to take black coffee,
Black coffee,
green
black tea.
tea, black
Like
tea.
most of the people are fond of tea or coffee, है ना?
And they're concerned about their weight
They-
also. The
yes.
females are very concerned about the weight also.
They do say कि they consume like 10 to 15 cups of coffee in a day. So it shouldn't be like a milk coffee, है ना? It should be like they can take in the form of like green coffee, green tea, black coffee, black tea. That is a better option.
So this was a gross teaching about the diet, what the type of diet and regular exercise is very important. So we're talking about comprehensive diabetes care. So a diabetes patient should know that in addition to following a proper diet plan, exercise plan, following a proper medical treatment, in addition to that, once in a year, a diabetes patient has to follow certain instructions, has to go for some investigations. The fundus examination, that is retina checkup, is very important. Dental checkup is also important for these patients, and thyroid checkup for some patients who have dyslipidemia. Or it's very common in our society these days. In diabetes patients, they are at risk of having thyroid disorder at the same time, mainly type 1 diabetes. And those patients who have some symptoms of cardiac disease, like dyspnea on exertion or angina on exertion, or feeling weakness on walking, so they should also go for cardiac checkup. Food checkup is very, very important, and annual inspection of feet, going for foot nerves checkup, very basic checkup, blood flow in your feet checkup. It should be done by a center who is a concerned person. A basic checkup has to be done by the doctor. The food checkup is important. Urine albumin creatinine ratio, checking for urine protein is also important, in addition to kidney function test or renal function test. These days, NASH or NAFLD is also commonly seen in diabetes patients. So checking for liver function test, going for a fibroscan or ultrasound abdomen is also important. So just controlling blood sugar is only a part of diabetes management. So at the same time, now we know that diabetes is a syndrome. So you need comprehensive checkup of diabetes patient. For that you need a comprehensive care center so as to look at all the complications of diabetes. So first we should try to prevent diabetes, work on that, follow a proper lifestyle, follow a proper diet plan, follow a proper exercise plan, start from the childhood only. So prevent diabetes should be our main motto. Once the patient has diabetes, control your sugars, control your blood pressure, control your lipids, prevent the complications of diabetes. Once the patient has the complications of diabetes, try to prevent end-stage complications. And once the patient develops all the end-stage complications, it becomes a very, very costly disease, and the patient loses everything financially and socially also, and the family has to suffer a lot. So our main message is, so diabetes management needs comprehensive care. We should have more of comprehensive diabetes care centers, and our department and our center is ready to help more and more primary care physicians and doctors who want to come and who want to get skill training at our center. and to develop these type of centers, or we are ready to share our project with them. Thanks a lot, the Torrent people who have the division also, and who has given this opportunity to us to share our ideas. Thanks a lot.